We're talking all about physical therapy today. If you've followed me at all, you know I am a licensed physical therapist. I've been doing it for 22 years. I absolutely love it. And I want to talk to you a little bit about what physical therapy is and what it means for you. So physical therapy is the process of using various things such as exercise, postural education, movement, ice, massage, many different things to help somebody either recover from an injury or help them come back from something they've been going through physically to get them back to a functional place, get them back to doing what they want to do on a daily basis. And there are many different kinds of physical therapy out there. So when we graduate from PT school, we graduate as a generalist, meaning we could go and really get any job as a physical therapist. And then people tend to specialize after that. So there are pediatric physical therapists for kids. There are respiratory physical therapists. There are orthopedic physical therapists, which is where I would put myself, categorize myself. So a lot of sports injuries, joints, muscles, back pain, those kind of things. And then I do a lot with women's health as well, with hysterectomy and prolapse and pelvic floor dysfunction. So how you get physical therapy. One thing to keep in mind is in all 50 states in the United States, physical therapy is direct access. That means that legally you are allowed to go straight to a physical therapist without getting a doctor's referral. Believe it or not, it wasn't always that way, but at this point, all 50 states are direct access. So legally, you can see a physical therapist without getting a doctor referral. Keep in mind though, insurance won't always cover it if you do that. That is different state by state and insurance by insurance. And then even within insurance, it's different plan by plan. So if you do want to use insurance to see a physical therapist, I highly recommend you call your insurance company, find out the rules and what you need to do. Okay, that's my first piece of advice. Second is look into people who both take insurance and then if it's available to you, some who possibly don't. So don't get scared off by people who don't take insurance. This is much more common nowadays. And sometimes you'll get much more individualized care. You'll get longer appointment times. Insurance really is limiting us as physical therapists sometimes on how long we can see you per time and also how many visits. So again, I know that that could be a detriment depending on your money situation. Please know that if insurance is available to you, you're going to have some great treatment options. Go that route. Don't ever let that be a deterrent to seeing a physical therapist. Also know that there are some other options out there too that will take cash, and you'll want to look at the pluses and minuses of both. A really big important tip I want to give you also is find a doctor who's willing to give you that referral. Don't ever take no for an answer if you feel that physical therapy would benefit you, okay? There is no reason in my mind that you should be turned away if you feel that physical therapy may benefit you and it's something you want to try. Talk to your doctor, explain why, get that referral. And if for any reason they won't give it to you, find another doctor who will, all right? I have seen so many people over the years who had surgery and for whatever reason they've told me, my doctor just said I didn't need PT, so they waited a year. They didn't start, let's say it's a knee surgery. They never walked quite right because they didn't build the muscles correctly after surgery because they were told they would just come back naturally. So they end up seeing me a year or two later. It's better to see me right after surgery when I can really help. So I highly recommend after any surgery that you look for some kind of physical therapy. All right, and then when you do go to PT, what will happen is that first visit is going to be intake, meaning we ask a lot of questions. You'll fill out paperwork. We are gonna do some measurements and tests of your strength and of your walking and your posture and all of those kind of things. And then we will develop a plan of care. And what that is how many visits we think we need, how long we're gonna see you for, what exercises we want you doing at home, and what our time together is gonna include, and what our long-term goals are. I think your PT should share that with you because you really need to be on the same team and have communication so that you have similar goals. So you as the client, you're gonna share your goals with the PT, because that's the most important thing. I wanna know what your goals are. I wanna know if your goal is to simply get on and off the floor again, or if you really think you're gonna run that half marathon in 6 months and we need to get you ready for that. That's important for me to know. And so I wanna know your goals, and I think it's important for you to know your physical therapist goals too, so that again, you're on the same page and you're working towards the same thing as a team. So that's what physical therapy tends to look like. You'll go a certain amount of times per week or even per month. You'll have checkups, and then you'll kind of have a reevaluation and decide together when you're done with your visits. And then typically, even when you're done with visits, you'll keep doing some exercises at home. So that's typical physical therapy. And then you'll have people like me that now, at this point, I am doing Zoom physical therapy. And so I'll see people for an hour, sometimes a half hour, depending on what they need, all over the world. It's absolutely amazing when you can do that and really get stories from people all over the world. And what I really like to do is do a lot of talking that first visit to find out exactly what my client wants and needs and their story and their history. And we look at the person as a whole, okay? So I'm gonna look at everything, like what's going on? Tell me about that, tell me about that. And what exactly do you want? And let's use workouts that I can give you at home to get you there. And many times what I'll do is give physical therapy exercises to do every day for the first month that last 5 or 10 minutes. So that's what you could expect. 5 or 10 minutes at home every day for a month. And then I'll include certain videos that are already on YouTube and say, this is gonna help, do that twice a week, and this is gonna help, do that twice a week. And then we'll check up in a month or so to help you progress. And if you need someone in person, I'll tell you that and say, you know what, I really think you're gonna need this in person. Let's help you find someone. And so that's what physical therapy can look like too. So it can look like many different things, but the most important things is that they are helping you get back to your normal activities. Again, whether that's walking or simply getting on and off the couch, or whether it's running or playing competitive tennis, whatever is normal and your life that you strive towards, that's our goal as a physical therapist, to help you physically get back to that. And if we can't do it, we're gonna help you get the tools you need, whether it's seeing someone else, whatever it is, we're gonna help give you the tools you need to get there. So I hope that helps answer your questions about physical therapy. Feel free to leave questions below and let me know, and I will answer them as I can, and I will talk to you soon.